If you find yourself with hip pain after sitting in the car or sitting at work, you may think that you have piriformis syndrome, and a lot of my patients have thought that. And over the past 10 years, I've had plenty of people come to me and say, hey, Michael, I've got some hip pain here. It hurts when I sit, and I keep stretching it out. I think it's piriformis syndrome, but I'm just not getting better. If that sounds like you, you're gonna wanna watch this video because a lot of people think it's their tight muscles, but it may actually be an irritated sciatic nerve. And today I'm gonna teach you exactly how to test and see if it's your sciatic nerve, and then more importantly, how to make it feel better today. I'm excited to go over this with you because I can't tell you how many times people have been approaching me and they're like, I've been stretching my glutes for so long, and yes, it gives me some transient or some short relief, but it's not long lasting. And so you have to remember the anatomy first. You have to remember that your nerve comes out of your lower back, it goes through the meat, through the glute, right down to here. And so a lot of people have radiating discomfort in this area when they sit. Now, you may or may not have had a history of back pain, and that's not required. But what's required is you're a human being. You have to have this nerve, which everybody does. And so you're thinking, okay, I want to stretch my glutes. It gives me some transient relief. Well, that's because the nerve goes right through those muscles. And so you're stretching the environment in which the nerve lives, which is great. And so I'm not saying stop doing this stretching. I'm saying on top of this stretching, you need to be mobilizing your sciatic nerve. So let's test it and then let's treat it. And so stickiness in the nerve is very normal. It doesn't mean you have sciatica, it just means you have a nerve that wants to be moved. And so when you sit for a long period of time, you're putting pressure on that nerve, and sometimes it doesn't like that pressure. Just the cards that you're dealt. It is what it is. But here's how you test for it. So you're gonna wanna be in the chair, either you're sitting in a chair at work or you're gonna be just finding a chair in your home. You're gonna assume a little bit of a slumped position, just like you've been here typing for a while or working. Then you're gonna take the leg that hurts, and then you're going to kick it out and pull your toes back while in that slump position. And if you do that and you feel it here, that is an irritated sciatic nerve, no doubt about it. So again, that is a slumped position. You're going to kick your leg out, pull your toes back, and if you're like, oh, Michael, that does not feel good at all, that means that nerve wants to be moved. So on top of your stretching, you're sitting here, you're doing your glute stretches, you're pulling it over. Yes, that can hit that area, but it's not hitting the nerve. And I want to teach you how to hit the nerve. And how do you know if it's normal for you or not? Well, test the other side. And so if you notice a big difference side to side, or one side feels more intense, you're going to want to mobilize the nerve, which we're going to go over here in just a second. And even if they don't, even if you don't notice a big difference side to side, even if you don't notice a huge discomfort here, it is still good for you to mobilize the sciatic nerve. So keep up your stretching, but then test yourself. Do the slump position, pull back your toes, and if you kind of feel it but don't feel it a lot, then look down just slightly and you will feel, and you can feel the entire pathway of the nerve, okay? So kick the leg out, pull the toes back, a slumped position. If you feel your familiar hip stickiness or hip stuff, that is your sciatic nerve telling you it wants to move. So on top of your stretching, you need to mobilize the nerve, which I'm gonna show you how to do right now. All right, I'm gonna use my Swiss ball here because I don't have another chair next to me, but you're gonna need two chairs for this. The chair you're sitting on, and then a chair to put your foot on. And that's the only way we're gonna be able to mobilize the nerve and really feel it here. So grab that chair, stay on this chair, and then start with a leg that is more uncomfortable. So I'm going to sit up tall. I'm going to put my leg up here that I want to mobilize the nerve, and it's just going to rest. And you're going to be in a tall position, and you're just going to pull your toes up and point them down. Pull your toes up and point them down. You will do this for 20 repetitions. And I've had clients, many patients of mine, when they pull those toes back, they can feel it all the way from the pathway from their back to their glute. You also may just feel your calf. That is a normal response. The calf only or behind the knee is a normal response. The response telling you that you have a bit of a sticky nerve would be you're going to feel it up in your hamstring or your glute or your lower back. So you're going to start off with 20 repetitions here. Now, it is safe to work and do these repetitions or just take the time to mobilize your sciatic nerve. I feel like that everybody has a desk job. If you're sitting more than 30 minutes at a time, you should be mobilizing your nerve at some point in time. Now, this is phase one of the treatment, is you're going to pull your toes back. And as you go, you may notice tingling. You may notice that the pulling is getting less intense. That's because the nerve is mobilizing. It's moving. And nerves are made to move. And when you move, it gives you that blood flow. And so a lot of times I'll have my clients do 20 repetitions here. You'll put the leg down, that tingling or that sensation will come back. I've had people say it feels cold or it feels like it's new or awake. I don't know, there's a lot of different ways to describe it. Then you're gonna go the other leg. Ooh, this one's much tighter for me. I feel it in my calf, I feel it in my hamstring or my side of my hip, and I pull my toes back. You're gonna do those 20 repetitions here. Now this is phase 1 of the treatment. So you may do this for the first couple days or the first week or whatever. Do you have to do these forever? No. If you're not having any more hip pain while you're seated, that is fine, then you don't have to do these. These are always here to make you feel better. They should never ever make you feel worse. Never ever. I say it like that because that's what my son says. He likes to say it like that. All right, now you're gonna do your 20 repetitions. You're gonna relax here. And we're gonna take a second here to give ourselves a break. If you like these neural mobilizations and improving your sciatic nerve mobility, you may wanna check out my book, Revision Sciatica. I go over a lot of neural mobilizations that's gonna allow you to keep that nerve nice and healthy, and it's gonna allow you to keep it moving, but to each their own. You don't have to do that. You can just do this exercise and go from there. Now, if you're not sure if you have sciatica, then I would take the quiz in the description. It's gonna say, do I have sciatica quiz? And it's just gonna ask you a couple questions to help figure out if you have true full-blown sciatica. Like I mentioned earlier in the video, you don't have to have sciatica to have a sticky nerve. A lot of people have a sticky nerve because they have a desk job, they're sitting a lot, and the nerve doesn't like to be sat on. So, that may be you as well. So check out that quiz, it's free. If you give me your email, I give you a lot of tips. So for the second round here, you're gonna put that first foot back up, you're gonna be tall. I actually assumed a little bit of a slump position, but this time instead of the up and down for 1 second hold, you're gonna pull up for a 5-second hold. 2, 3, 4, 5, and relax. Pull up, 1, 2, 3, 4, 5, and relax. Whew, I need a little bit more of a break with this one. A lot of my clients are like, this does not feel good. I don't wanna hold this position, because you're tucking your nerve. 1, 2, 3, 4, 5. We're gonna do one more here. 1, 2, 3, 4, 5. Now, if you notice you're not really feeling it anymore, then you can assume more of a slumped position and pull your toes back. But I'm telling you, be careful here. You're going to feel a big pull. It is mobilizing that big sciatic nerve, and you're sitting on it at the same time. And so you could definitely feel this. 5 repetitions for a 5-second hold on each side. For me, when I go down on this side, I feel it in my glute. I feel it in this spot, just on the other side. And that's just telling me that this side is a little bit more sticky. I don't have sciatica on my right side, it's just stickier. I say sticky because we just don't really know, I say sticky in that it just doesn't feel great, so we're gonna go, now everything is tingling, everything is really, it's making me sweat a little bit. You're gonna hold that for that 5-second hold and relax. Hold that for the 5-second hold. 3, 4. Relax one more time. 1, 2, 3, 4, 5. Whew. Now, as you continue to do that, it should feel better in that area. Now, you may need 5 reps to feel better. You could do 15, 20 reps to start off with. That's okay. Don't start off with the long holds. You're not ready for that unless you've been doing it for a long period of time. And then you can get back into your stretching. You can go into that big piriformis stretch, push that knee down, lean forward, or pull that leg over to stretch the glute. There's nothing wrong with stretching the muscles of your hips. But what you're missing is mobilizing the sciatic nerve. So let me know in the comments if you felt it. Did you feel your sciatic nerve pull? Did you feel that burn? Did you feel that uncomfortableness? Because that means you're doing it right. And this happens in 100% of people. I've never had a person who didn't feel that. So if you didn't feel that, you're probably not doing it right. So ask me in the comments and I'll get back to you. It's important to know the difference between a muscle stretch and a nerve stretch. So stretch your glutes afterwards, pull that leg up, lean into it. Feel that good glute stretch. So now you know that you're addressing your hip discomfort here. It's not only a muscle thing, it is a nerve thing as well. So stretch your muscles, move your nerves, and I promise you're gonna feel better.